So, having said that, we actually did test your program out a little bit, and I sent you a video so you could perform a movement assessment on me. And I will put that video on the screen now.
Welcome to an exclusive Move Pain Free movement assessment. I'm recording this before Mark and I hopped on, so I hope you're getting a ton of value out of the conversation and finding all the answers you need. Before I dive into Mark's specific movement patterns, I want to give you a visual of the 3 pillars of pain-free human movement that we use at Move Pain Free to coach you toward using your body the way it was designed and start moving without back pain. First off, the 3 pillars of pain-free human movement are skeletal alignment, muscular tension, and joint access or space in your joints. Let's take a quick look at each of these. Skeletal alignment refers to how our skeleton is stacked relative to itself, both at rest and during movement. When we look at pain-free movers like young kids, injury-free super athletes, and even 89-year-old ladies that can sprint up hills like this one here, we always see the spine, which is shown by the chest direction, aligned with the hips and the ankles, which are shown by kneecap direction. During aligned standing, you'll see straight feet with the spine, hips, and ankles matched up perfectly with each other from the front view, and the hips will sit a bit behind the ribs from the side view, just to maintain those natural spinal curves. Without alignment, the feet start to turn out, the hips press forward, and we'll lose our natural spinal curves. During aligned movement, the spine will actually move from side to side while it transfers energy, and the hips and ankles will follow it in sequence. This brings us to muscular tension. When your muscular system is properly tensioned during movement, the spine will lead the action, and your hips and ankles will follow in a nice, easy, efficient path. When you lose natural tensioning, we'll see the leg rotate the literal opposite direction of the upper body when the foot leaves the ground. This causes issues with energy transfer, and when the body starts to compensate for this energy transfer issue, we start to run into pain and injury. The main way the body will compensate is by losing space in your joints. This brings us to the final pillar of human movement, joint access or space in your joints. Your joint capsules, whether in your spine, your hips, your knees, or anywhere else, are meant to have lots of space to move. When you lose alignment and tension in your body will actually react by lowering the space available in those joints, and you'll lose access to a lot of your mobility. We call this compression. But why does the body do this? Well, it's acting as a bracing mechanism. Your body has lost confidence that it will naturally stay safe, so it's going to lower the movement ability of each joint and hopefully lower the damage being done in the process. But what really happens is you'll continually wear away at the tissues inside the joints since there's not much space to operate, and you'll keep running into pain and movement issues. Now, let's take a look at Mark's movement assessment film, and I'll show you what we look at with each of our clients. Looking at Mark's resting alignment, his feet are turned out just a bit. We usually want the second toe to be straight forward, and what that tells me is his hips are pressed forward, forcing his femurs and his shins to spin outward, and his feet are turned out to compensate for that. We'll definitely pay attention to this when it comes to his walking and his running patterns. As far as alignment from the side view, you'll see a bit of a resting hip thrust pattern, which is what's spinning those femurs and shins outward, but it also tilts the spine backwards and puts a bit of compression into the spine at rest. That compression usually carries over to the movement side of things. Now, in Mark's walk and his run, you'll see right away his leg actually spins in the opposite direction of his upper body. This is showing a lack of tension in his movement patterns. A simple way to say this is that his body has some slack in it, and his lower body isn't able to follow his spine for efficient movement and energy transfer. Now, Mark actually has good spinal action while he walks and runs, so that's a good sign that his spinal joints aren't compressed into having no space at all. We just need to work on the resting and movement alignment piece and find some muscular tension, and Mark's movement will shape up nicely.